You are listening to The Dish on Health IT, brought to you by Point of Care Partners, a leading health IT consultancy. Each episode will feature a rotating panel of senior consultants and guests who will talk about trends and innovations in health IT, while also highlighting how organizations can leverage these advances to solve their business problems. The Dish on Health IT welcomes John Hill, Executive Director of the NCPDP Foundation, and Larry King, Director of Intelligent Prescribing with Surescripts. Host Tony Schueth, CEO of Point of Care Partners, will speak with our esteemed guests about pharmacy interoperability. The conversation will highlight some of the findings from the POCP published Pharmacy Interoperability White Paper, which was funded by NCPDP Foundation and heavily supported and advocated for by Surescripts. This episode will highlight various industry work to progress pharmacy interoperability, challenges that remain, possible solutions, and ways our listeners can get involved. We hope you enjoy the episode. If you have ideas for future podcasts, email us at podcast@pocp.com or submit suggestions on our podcast page at pocp.com.
Hello, everyone, and welcome to The Dish on Health IT, where we invite health IT innovators and catalysts to break down and discuss some of health IT's biggest news and most exciting milestones. We at Point of Care Partners are health IT consultants who work with stakeholders across the healthcare ecosystem and are viewed as independent, objective partners. I'm Tony Schueth, the CEO here at POCP, and I'll be your host for this episode. I'm very excited today because we're going to be covering pharmacy interoperability, specifically related to a POCP white paper we published at the tail end of 2024. This document was funded by the NCPDP Foundation and is heavily supported and advocated for by Surescripts. I'm happy to welcome John Hill, the Executive Director of the NCPDP Foundation, and Larry King, Director of Intelligent Prescribing with Surescripts, to discuss insights from the white paper, as well as really dig into why this is an area the industry should really be paying attention to and what their respective organizations are doing to move it forward. Since we wrote the white paper, I'll be chiming in to provide insight and color, but we're really looking to dig into this topic with our guests and highlight various perspectives. Before we dig into our topic, I'd like to ask each of our guests to introduce themselves. I'd love to know how you found yourself in the health IT space and the background that led you to your current role in this organization. John, I'll ask you to go first.
Thanks, Tony, and happy to be joining you all here today and with Larry as well. A special thank you to you and your team in hosting today's podcast. Prior to joining NCPDP, I spent over 25 years in business development, working in health systems, payers, and processors. Before I joined NCPDP, I was heading up my previous company's expansion within China and international markets. During my for-profit tenure, I had the opportunity to work directly with NCPDP as a member, serving on various co-chair roles such as Larry, and I also had the opportunity to serve as chair of the strategic planning, which led me to serve on the board, and eventually I became the board chair prior to becoming a staff member in 2017. Currently, I oversee the day-to-day operation of NCPDP, and I have the pleasure of being the executive director for the NCPDP Foundation for the last 3 years.
Thanks, John. Now, Larry, let's hear from you.
So I would just start out with that, certainly share John's excitement for our topic today and the conversations. It's one that's definitely near and dear to my heart. A little bit about me. I started my career as a pharmacist at a crazy high volume retail pharmacy in downtown Brooklyn, New York, and got stories for that for another day. But frankly, it didn't take me long to realize how vast and complex patient needs are and the challenges that come along with it. Every day I witnessed a myriad of roadblocks that stopped us from providing the level of care, not just in managing health, but also the access to care at the right time. That experience to me was incredibly eye-opening. It made me realize that I wanted to be able to empower patients and equally important pharmacists. And if we were going to do it, we had major work to do from a technology perspective. Since then, I've been really passionate about driving my career towards pharmacy and specifically about advancing roles in healthcare technology. How do we improve the provider and patient experience? My primary focus has been around clinical informatics, electronic prescribing, and more importantly, leading cross-functional industry initiatives. Today, as the Director of Intelligent Prescribing at Surescripts, I'm focused on creatively bringing solutions that help our providers coordinate care more effectively and more efficiently.
Thank you both. It's obvious why you're both on this, and your passion really jumps out. Now let's put a little bit of a foundation on our conversation. First, I'd like to start by offering the definition of pharmacy interoperability as I see it. First, more generally, interoperability enables the secure exchange of health information with and the use of electronic health information from other health information technology without the special effort on the part of the user. It also allows for complete access, exchange, and use of all electronically accessible health information for authorized use under applicable state and federal law and reasonable and necessary activities that do not constitute information blocking. Now, in defining pharmacy interoperability, we're focusing on building a bridge to enable that kind of seamless data exchange between a pharmacy care setting and the rest of the patient's care team. Let me ask our guests if they want to add anything to how I've defined pharmacy interoperability before we continue discussing the reasons it's so important.
Yeah, Tony, I would agree. Sorry, Larry, I'll take this one first. Tony, I would agree with you. I would add, from an NCPP perspective, when we have discussions with our board members, our general members, and industry, regarding interoperability, we always keep bi-directional top of mind and making sure the data can be accessed in a standardized manner for all stakeholders. Another point that is, in the forefront is what you said, without special effort. From the user, it should always be in workflow and reduce burden for providers and pharmacists. This white paper was a pivotal step in identifying opportunities to improve interoperability and the active engagement of pharmacists as part of the patient's care team.
John, I love the workflow comment. I think that's critically important. And really would echo kind of statements from both of you. The piece I'd add on that when we say interoperability, we really start to refer to the ability for that information to flow across systems. And where Surescripts sits that network partner, that across system is really important. It's information sharing that lets care teams and care managers get the clinical insights they need anytime, and equally important anywhere. At the end of the day, we're really connecting those who have the role in caring for patients so they can have better care. And I think getting close to that better care is so important.
Thank you guys for the insight. That's really helpful, and I think it really clarifies what pharmacy interoperability is. So then, now that we've defined it, let's start uncovering why it's so important. So we here at POCP have written a lot of content and given a lot of presentations on the expanding role of the pharmacist, whether offering patient care services such as immunizations, comprehensive medication reviews, or chronic disease management or other clinical services. We see this as an area our clients should be paying attention to because there are opportunities for health tech vendors to offer solutions, payers to examine their reimbursement models related to care services delivered in the pharmacy setting, and providers to partner with pharmacists and offload certain basic services so practices can focus on spending time with patients who may need more attention, uncovering the source of their issues. Of course, the reality is that the current pharmacy business model and profit margins will have to be sorted out. I've given POCP's reason for looking at pharmacy interoperability as a critical area in the next few years. I'd like to ask each of you why it's important for your organization. This time, Larry, let's have you go first.
Tony, I'd start with a kind of a bold statement here that this is absolutely a top priority for Surescripts. It's going to continue to be for the years to come. As pharmacists play a bigger role on their care teams, that ability to work right alongside the physician and other providers, it's not only important, but it's critical that everyone who's operating from that same level of intelligence, it's a playbook, right? You've got to have the same language, the same rules. We're really proud to support initiatives like this white paper because it's all about giving the pharmacists that insight they need to make the real impact. As we alleviate administrative burden, we're freeing up the time to do more meaningful work. And I mentioned earlier kind of my time in Brooklyn, New York, but my mind immediately goes to those hours, and I really mean hours, on hold trying to get hold of a clinical staff member or get a hold of that clinician who has a simple piece of data. We call it critical data, but really it's in the chart. It's a simple piece of data we already have. And so the ability to do this by streamlining workflows, providing clinical intelligence, critical intelligence, and enabling better integration into that care team is just the linchpin to success. At the end of the day, it's really about that enabling the pharmacist to deliver that safer, higher quality, and equally important, cost-effective experience to patients everywhere.
Absolutely, Larry. You know, Surescripts reports, surveys, and industry market research always provide a lot of insight into these trends. John, can you speak with different hats on? From an NCPDP Foundation standpoint, can you explain why pharmacy interoperability is a priority for it? But then can you also do the same with your NCPDP standards development hat on?
Sure, I'd be glad to. Yeah, right. Who am I today? First off, I'd like to have a special thank you to go out to Larry and Surescripts that were a major donor of the Pharmacy Interoperability White Paper completed by Tony, you and your team. In addition, I'd like to also thank First Data Bank and GoodRx for their support of this grant as well. So with my foundation hat on, you know, the NCPP Foundation is primarily focused on supporting grants that expand the role and value of the pharmacist, enhance patient safety, and increases patient access. And this white paper hit out of the park in being able to support all three of those pillars. I think when looking at where the foundation is today, we really are looking at a mission-driven opportunity to support standards that demonstrate the value of what NCPP is doing. So when we look at grants, you know, typically in the past, we were more focused on really proving NCPP standards and demonstrating the value of how they move the industry forward. But when you think about interoperability and the complexities that you laid out in the white paper, and the understanding that there's a lot more work, which we'll get into, to help support the data exchange, it's really critical for our foundation to be able to have opportunities to support funding, just to show that to the industry and to provide an awareness campaign and education. You know, we've come a long way, but there's good work that still needs to be done. I think looking at this with my NCPP hat on, I would say that, you know, as Larry said, interoperability is critical. It has always been top of mind in developing standards for NCPP. You know, last year, NCPP worked with ASTP, ONC in supporting the pharmacy high-tech recommendations, with a priority being addressed for association collaboration to support interoperability. Clearly, interoperability was key there. And there's been key collaboration between associations such as HL7 and NCPP and how we're trying to support advancing e-care plan and the adoption of e-care plan across the healthcare ecosystem.
And I really have to, you know, commend you and HL7 on that work together. I mean, it's really not all standards development organizations work as effectively together as you guys do. But I want to thank both of you for sharing why your organizations are prioritizing progress toward pharmacy interoperability. Now let's dive a little bit into the challenges pharmacies face in advancing this work. As we outlined in the white paper, many pharmacy technology systems are outdated, not designed to exchange clinical information. Even when data is available, it's often siloed. We also broke down the challenges by pharmacy type. Community pharmacies, not surprisingly, face significant hurdles due to limited resources and the inability to make necessary investments. Chain pharmacies are juggling corporate policies, patient privacy concerns, and enterprise-level complexities. Meanwhile, specialty pharmacies are more focused on challenges like standardizing data to enable seamless exchange with external stakeholders. While these barriers are real, they're not insurmountable. With that in mind, I'd like to hear your perspectives. What are some steps pharmacies can take to begin to address these challenges and barriers? Are there strategies or opportunities that you think hold the most promise for making meaningful progress? This time, let's start with John, and then Larry, feel free to chime in.
Yeah, that's a great segue, Tony. And I think there is significant opportunity, especially in how do we support pharmacy engagement. You know, in the white paper, it reviewed the industry needs to look at, you know, reimbursement models and financial incentives, and really, you know, stepping back and the fact that the pharmacists should be able to get paid for the service that they're doing, right? And what does that look like moving forward? And to support them and provide the clinical services that we know that they all can do. I had talked about this, I think, previously, but one of the primary goal under NCPB's Work Group 20, Coordination of Care and Innovation, is really to step back and look at about how pharmacists can be incentivized to support these type of clinical opportunities and the work that's being asked from them, and really taking it out from the standard day-to-day billing transaction standard that NCPP has been working on for the last 40 years. This is a game changer and a crossroads for NCPP as directed by our Board of Trustees. And, as we have conversations with our friends at Surescripts, industry leaders, and frankly, when we have conversations with ASDP and ONC, and looking at the value of the pharmacy and the role that they play, what does that new model look like? And we know that there's going to be additional standards under NCPP to support how are you able to share that data across multiple platforms, from A to Z, in order for at the end of the day that the patient's getting the right medication at the right time, and the pharmacist is there on the front lines to help provide that coordination of care and being paid for it. So I think it's a really interesting time for NCPP as we roll up our sleeves in that work group and start looking about what do those new reimbursement models look like, and how can standards help make them more efficient and less manual intervention.
I get really excited hearing kind of that collaborative cross-functional approach and how that builds consensus. To me, that is the unlocking of the future. And I just add that making interoperability a priority is just an absolute key for pharmacy to tackle some of these challenges. Pharmacies can and really should get started on that path towards interoperability now. And it's really by adopting technology that enables real-time data sharing and integration with other healthcare systems and technologies. I mentioned earlier our deep investment, but at Surescripts, it's something that we're really committed to in thinking about helping closing these critical information gaps. And really, how do you deliver timely patient insights while creating better communication channels? And that channel is really, I think, where I want to continue to emphasize. When pharmacists have that actionable intelligence at that point of care, and again, that goes back to our workflow conversation at the top of the call, they're really able to make those smarter, faster decisions that lead to the safer and better outcomes. The plug I'd make here is that I'd also encourage pharmacies to start getting into the game around qualified health information networks, that term QHIN you keep hearing, as part of their bigger interoperability strategy. These QHINs are really going to open up opportunities for secure nationwide, and that's so important, nationwide data exchange. That could be a huge step forward in helping pharmacies access and share information as they stay connected across that broader care team. What I'd say is that Surescripts, our health information network, is currently in a QHIN candidate status. Once designated, we'll be able to be at scale and really have that effectiveness the Surescripts network is known for, when we get most excited about in that really meaningful way. And lastly, by focusing on these areas, pharmacy can not only overcome the barriers that they've always faced, but they're able to play that bigger role that we know that they can do in that healthcare ecosystem moving forward.
I think, one of your points on outcomes was really well taken. I mean, that's really what it's all about, is improving patient care. And pharmacists can play such an important role in that. So I'm glad you brought that up. Now let's shift our focus to business model and process transformation that will be foundational to improving pharmacy interoperability. Let's start by looking at the financial aspect of this. Reimbursement models for clinical care provided in the pharmacy setting aren't consistent or predictable. Additionally, there aren't currently any incentives for interoperability investments, whether in investment models or regulatory incentives. In your views, what steps do you recommend be taken to develop sustainable financial incentives for pharmacies? Who do you think will ultimately foot the bill for technology investment needed to connect the pharmacy setting with the rest of the healthcare delivery settings? Larry, can you go first?
Yeah, happy to. Tony, I like the way you tee that up, and you kind of talk about the frustration. And the frustration, I think, is what we hear when we have conversations with partners or pharmacists in the field. It's not for a lack of wanting to be there. It's for a lack of having the ability to get over that threshold. And I would say at Surescripts, we definitely see the need for changes across a broad spectrum, including policy, technology, payment models, and really helping our pharmacists fully step into their role as that essential member of a care team. One of the biggest challenges I see right now is that reimbursement for clinical pharmacy and clinical services in pharmacy, it's not consistent. There's programs out there, but there's really no incentive to invest in interoperability. We keep asking pharmacy to step up and queue in and get involved, but if there's not the driver to go out and invest in technology, it's really hard to get leadership support to go and build these things. And it's a barrier we need to address. When it comes to building sustainable financial incentives, it's a team effort. And I know John previously mentioned Work Group 20 at NCPDP that's focused on innovation. To me, this is a linchpin of driving success in an area that we can absolutely build a think tank and absolutely build consensus across the industry of how do we start to build these scalable models that provide some of these incentives. This group has the potential to contribute to industry standards and policy, so that's important, standards and policy, which is a little different dynamic, to better align reimbursement with those clinical care models that pharmacies provide. And then there's the question of the kind of framework you put out there. And there's been programs out there of care models and expanding reimbursement codes and value-based care and programs that CMS has sponsored. And all of those really are game changers that make a big difference. But making sure that the pharmacist is fairly compensated and built into those programs is an area where we've had room to grow. And there's currently a gap that I see as working to close. And then the last piece I think you asked on is the investment in technology and what that means. Pharmacists are going to need to prioritize the systems that work smoothly with other healthcare systems. It's a bit of a chicken and egg, but these incentives and having the technology are going to have to run in parallel. And then whether regulatory or payer supported, how do you make it more achievable? And then the last piece I'll add again is the plug on QHIN and developing it under TEFCA. To me, I think this is critical in unlocking a step towards creating a nationwide data exchange network that could make this interoperability actually buildable at scale and frankly practical.
John, is there anything you'd like to add?
I'll just add a few points to that. I think from NCPP's perspective, and I would agree with what Larry said, I would say that, really, I'm always, a fan of you got to crawl before you walk. And I think, your white paper, Tony, the point care white paper really highlighted this, and the fact that we really need to step back and define what's the minimum data set available? What are the critical data elements we need, right? And I think if we can use, back to Larry's point, if we can use Work Group 20 to help support and getting the right folks to collaborate to show what that may be and what those standards may look like to exchange across bidirectionally. Now I'll put my little take off my NCPDP hat. That would be a phenomenal foundation pilot for the foundation to fund, right? What would a pilot project look like if we could define what those critical data elements are and how, if we be able to automate the exchange of that data, then we would probably be able to have a better conversation with the players on, okay, this is the value of what a potential financial incentive model may look.
Really good points, John. Thank you both for some really prescient points. Now I want to shift a little. So far we've focused on pharmacy and payers, whether it's the pharmacy business model or the payer reimbursement of clinical services in the pharmacy setting. Now I'd like to get into the practicalities and the role of other emerging technologies and standards. Obviously, NCPDP standards will have a huge role to play in the pharmacy transactions, but we're also talking about the exchange of clinical data, so it seems like HL7 and FHIR would have a role in pharmacy interoperability as it firms up and becomes real. Would you agree with that, John? I know you already talked about NCPDP working with HL7. Maybe you can expand on that a little bit more.
Yeah, I'd be happy to, Tony. I would say that, yes, we do have the opportunity to support additional crosswalks, in my opinion, with FHIR, similar to the work that I've already discussed with the e-care plan, how we promote and improve pharmacy data exchange and having pharmacy, like I said, a seat at the table, supporting NCPP in developing and defining, core data sets as we talked earlier. I would say that as you look at this, there's still a challenge right now with the adoption of the e-care plan. So again, the collaboration and coordination between HL7 and NCPDP and providing that awareness that is there to take advantage of, I think something that we can continue to work on. And I also believe, in our conversations that we're having, we meet, the good news is NCPDP's executive team meets with the HL7 executive team on a quarterly basis to really kind of step back and look at where do we have some synergies right now on where our standards are evolving and how does that integrate with Bayer and the implementation both of Bayer. And I think as we look at potential alignment with Da Vinci and Codex and other accelerators, there's a lot of lessons learned on how we approach the e-care plan, where additional crosswalks could be completed and fairly quickly that could be used in between, NCPP and HL7. And I think now as we move forward, just keeping in mind the integration and cross-pollination on how TEFCA could potentially help expand that. So I'll say that, as we move forward, there definitely is going to be some additional opportunities, and where NCPP is trying to go is we work with HL7 is really stepping back and looking at, is there some low-hanging fruit on the accelerator models right now that we can take advantage of and promote, like I said, some additional crosswalk initiatives.
Larry, since we are a co-chair of the Da Vinci Accelerator, and we're well aware of Surescripts' involvement in Da Vinci, and we are aware that Surescripts uses both HL7 and NCPDP extensively. I don't know if you want to sort of add anything to what John just said in any of your experience.
Yes, and I think, it's the diversity of thought here that I think is where we're going to have the best solutions. And so, obviously our commitment to NCPDP is in the forefront in an area that we are incredibly passionate about and want to continue to see move forward. We recognize that having the relationships with things like Direct Trust and HL7 are going to be critical to making sure that in each of the very distinct ecosystems of the healthcare system, having consistency and having the right thought leaders plugged into those spaces is really important. And so I think, driving it in this space will be where we invest, but also, understanding HL7's role and Direct Trust's role to make sure that really those are the best outcomes with standards across the entire continuity of the system.
That's a really good point. And I know that you guys are innovative. And, when you think about expediting improved pharmacy interoperability, have you thought about AI? And, how does that fit into all of this?
Tony, I'd start with, over the past 2 decades, we've put a ton of investment in innovation. And you keep hearing me kind of say the words of scale and, nationwide, but to me, those are the only tenets that make it successful, is when you can do it repeatable across many markets. I think the easy answer here is that AI is going to be an absolutely powerful and incredible tool, and tool is important to continue to drive that innovation. The network holds an entire data set in terms of size and scope and clinical relevance and data quality. But understanding how do we best leverage that data and get to the punchline and get to putting the right data in front of the clinician, in front of the pharmacist at the right place when they're using it, is where I think AI can be really powerful. Optimizing existing technology, increasing value, and helping our network alliance participate faster with better business and clinical decisions. I'd offer a couple examples of what we've done at Surescripts with AI and how they're applied in a larger scale. It will be interesting to have a conversation on, but currently we're using artificial intelligence to parse patient directions. Using that information that we've learned either through machine learning or AI, we're able to build on a feature that NCPDP has been working on for a long time with structured and codified SIG. At Surescripts, we call the technology we're using SIG IQ, and really starting to apply how do we better augment data and better provide actual clinical intelligence to pharmacists and providers in our medication history product, as well as our new RX and e-prescribing product. Another area I would hit on that AI has been really powerful in helping us is really around monitoring network activity. So how do we use it to detect possible misuse, non-compliance, and really think about that anomaly detection? As you think about pattern recognition and machine learning, that's where they're so powerful in areas that we've been able to apply that. Undoubtedly, AI and machine learning have the potential to lift administrative burden and much more. But what I would say at Surescripts is that we are proceeding down this path with great caution, but with also great interest. understanding that safety and security are going to need to be top of mind. At the end of the day, we will only integrate AI into our products where we're confident that we're meeting those levels of safety and security, because that's what the expectation is from patients, providers, pharmacists across the whole network.
Don, I know you've given some thought to AI as well, and there's an innovative work group, and Rick is working on it. Do you have some thoughts on AI?
Yeah. I would say, again, being the non-technical guy in the room, I would agree that AI plays a part in determining how it may support, data exchange and workflow in our standards. Just want to make sure that your listeners knew that the NCPP Board of Trustees did approve an AI special committee last year to really start beginning to explore AI opportunities and how NCPDP needs to start looking at tools to support the exchange of AI for our standards. And primarily, you think, everyone would, applaud us finally when we decided to move to JSON, right, for our telecom standard. But we now need to start looking at the opportunities on how can we benefit or use AI to benefit. So it makes it a lot easier for our friends like Surescripts to ingest our standards into their systems, and less resources and more cost effective. But Larry pointed on something that was very important. And, you think about security around AI again, we are an association. So the big ploy this year too is to look at governance. How is AI going to be governed as an association? And we're in the process of looking at other associations and working with them to be a convener where we can all learn from each other, so we're not starting from scratch on just the basic tenets on how AI is going to manage not only our standards process, but how we run our day-to-day operation and managing our work groups. There's obviously, for example, real quick, there's definitely opportunities and tools for AI to support us during minutes. You think about the time and resource that NCPD spends on our 80 task groups, our 12 work groups, and all the minutes that we have to do at the board meeting, committee meetings. That's a huge game changer for us to really then redeploy those folks to do better and bigger things.
So what you're saying is that Margaret Weicker is a big champion of AI.
Absolutely.
Because she and her team are excellent at minutes, but it can be time consuming.
It can, for sure.
It's interesting. We work with a number of payer clients, and that's one of the things that we set up, help them do initially, is set up that governance committee. So I'm glad you're working on it. We're all on the same page about the importance of governance and how AI is applied. So we've talked about a lot of aspects of pharmacy interoperability and how it would impact care providers are providing, including pharmacists, and things payers need to consider. But I'm curious what an ideal future state would look like for patients in your minds. If we do work well, how do you see patients' experiences improving? And I'll add, do you think that this could also benefit general practitioners? Larry, let's start with you.
Tony, if I get to be pie in the sky for a minute and kind of think in future, the word that comes to mind for me is really around seamless, in that you don't know it's working. It just does the right thing. And so where they walk into any pharmacy, and thinking really in patient shoes, they walk into the pharmacy, any doctor's office, and the provider already has everything they need. It's a complete, accurate picture of their health. And you think about what that looks like, medications, allergies, conditions, treatments, it's all there. I think of my parents who go to a number of doctor's offices, and they carry around in their wallet a little med list, and they carry, all of the things that they had to do, and for good reason, because it's important that everyone gets the correct information. But, in that world where there's no more repeating the same information at every visit, or worrying something got missed, something got forgotten, I didn't share with my provider a key data element that would make a decision. For patients, that means fewer delays, it's fewer errors, and again, hitting a better outcome. So again, imagining the care and the medications you need, and all that back and forth is gone. It's seamless, it's there. And then finally, absolutely, I think general practitioners would benefit as well. There's no doubt in my mind that this is an area where the entire ecosystem, provider, clinical staff, front office staff, pharmacists, all can benefit. Right now, so much time is eaten up chasing down that information, trying to fill any manual gap. So any better data sharing between pharmacists and providers, practitioners, it absolutely changes the focus, changes the initiative to treat their patient. And that's a cool moment. That's what we all went to pharmacy school, med school. We went in it for the patient. We didn't go in it for the medical record system or the pharmacy dispensing system. And so getting back to that patient to me is just the ultimate. At the end of the day, it's about interoperability. It's not really about the tech. It's about creating that healthcare experience where patients feel supported and the provider, no matter who they are on the care team, have what they need to deliver the best care possible. That's what we're aiming for at Surescripts. I believe that's what NCPDP is aiming for. And it's really the future that I'd love to see. Absolutely. Well said. John, is there anything you'd like to add?
Yeah, Larry stole my thunder, but I just want to
go first, John.
No, you're good, right? I think as we look at it, a better experience for all, right? Better data in the hands of the providers and pharmacists is going to enhance overall experience, not only the patient, but for them. Step back, and Larry, when you said, your poor parents having to, put the scripts in their pocket and then take that list with them. I mean, how many times in your own experience do you go to the doctor? You got to fill out, what drugs are you on? When was your surgeries? How many surgeries have you had? And then you go to another specialist 2 weeks later. You got to do the same thing over again. Imagine a world where you can have that readily available and share it with everyone. And you think too, from an AI perspective, unfortunately in 2015, I was met with a major health issue, a major health scare. And I think about the time and hours I spent on trying to summarize everything that was going on in my health. Then I could send it to my parents, and I could send it to my friends. Think about having a physician in there with some type of co-pilot AI, where it's just basically summarizing everything he's saying, and then you can text it out to your friends, right? That's a better experience for me than to, have in my hands and be able to really understand what's going on with me, and then be able to share it without having to regurgitate or remember what they said. So I think, Larry, your whole better healthcare experience is right on the mark, and I'm definitely where this is going.
John, a little sidebar comment you brought up that kind of made me laugh. About a year or two ago, my dad was having a surgery. I think it was his knee surgery. And I think there was a data breach or something was going on at the health system. Right. So they were in a little bit of extenuating circumstance. But the provider came in with no computer in the room with a clipboard, and I nearly lost my mind. I'm like,
oh my Lord.
This is my career, right? Like, this is what I do at Surescripts, is exchanging data. And
right.
to have to go through that in the room with the page, it was... I had to, I think, text my boss and say, is there something we can do today?
Right.
But that's 10 years in the past. We're looking 10 years in the future, but it certainly brought that experience to mind.
Oh, for sure.
But I love this discussion, and I always like to add kind of the other side of the coin. When we moved about 6 years ago from South Florida to North Florida, in South Florida, I was a patient at Cleveland Clinic. In North Florida, I'm a patient at Mayo. And when I was leaving Cleveland Clinic, I said, hey, I want to take my medical records with me. And they said, oh, you don't need to do that. And I said, what do you mean? I want to take it with me. I mean, I'm in this business. They said, you don't need to do that. All you need to do is fill out a form when you get to Mayo, and they'll be able to suck it right in. And so I went to my, visit, and I signed the form. And sure enough, I mean, before I left that office, they had all my information from Cleveland Clinic in their system. And this was before Mayo had converted to Epic. So Cleveland Clinic was Epic, but Mayo was still on their homegrown system. So, it does work. It works in, unfortunately not equally across the healthcare ecosystem, but it does work in some places. And so I always love to tell that story too, because I think we're getting there. Maybe not as fast as any of us would like. We're all patients, right? That's another thing I always remind everybody, but we're getting there. So, okay, as we close out, we'd like to ask our guests if they have any final message or calls to action that they want to send to the industry. Maybe you each want to mention any specific work groups or projects that they could get involved with. Or is there something our listeners could start doing in their own organizations? John, I'm going to start with you.
All right. Thanks, Tony. And, from an NCPDP perspective, I mentioned work group 20, core issue care innovation. Really, this work group needs support from industry leaders and moving standards forward, like I said, outside a normal billing transaction. Today under that work group, we have the ADT Admission Discharge Transfer Task Group. It's also exploring additional data elements and assisting patients as they transfer, with their medications from the hospital setting back into the home setting. And again, as we talked earlier, having additional stakeholders at the table to define those minimal data elements that everyone needs in order to make the path happier and a better experience for the patient. We definitely, I would call you out there for support on that. Also, we have the Pharmacy Technology Innovation Task Group under that work group as well. That's really where interoperability is sitting right now today, and looking at potential AI opportunities and how do we advance interoperability as we discussed in today's forum. Under NCPDP, again, to become a member is only $825 annually, and you get access to all our standards and voting privileges to move the industry forward. And as those task groups I brought up, you do not have to be a member to participate in the task groups. And the task groups meet, once a month or twice a month, but they're always on phone calls. So it's really easy for you to get engaged with them. And so I think those are some highlights I'd like to promote today.
Larry, do you have any thoughts, any recommendations?
My first thought really would be a simple call to action. We've talked a lot around it today, but if you haven't had the chance to review the white paper, as well as the recommendations made by the Pharmacy Interoperability Task Force at ONC ASTP, let's start there. I think these are really important resources that take the time. I think they lay out a really nice roadmap for action. Both took the time out to create these executive summaries that have top 10, top 12 next steps. Start there. The next thing I'd call out is there's significant work in many different pockets on interoperability. We touched a ton on NCPDP's work. We hit a little on HL7 and direct trust. The other one I'd call out is in Sequoia. There's some work in the Sequoia project that Pooja Babra and Melanie Marcus from Surescripts are working on, Pooja from NCPDP, and they're co-chairing. And I think there's going to be some really awesome action items that come through that as well. And the last thing I'd say is probably more of a lofty goal, but I think this is now our time. It's time for us in the pharmacy community to get involved. There's very few times that you can have a legacy building moment, legacy building impact. And I think we're comfortable saying that the enablement of the exchange of data at scale in a nationwide way is one of those moments. And it really is a legacy and industry changer. And that, I love the story you told, Tony, about moving and going from system to system. That's what this looks like day to day at the smallest moments as well as at the most macro moments. And so that's what I would leave you with.
Absolutely. And there's a need. I mean, there really is a need. We have, pockets of deserts, if you will, where we don't have enough providers, but we have pharmacists that are there, and they're positioned to help. They're well trained. They can, they have a license, and they don't always operate at the top of that. So there's a huge opportunity for them, to improve patient care for pharmacists and their contribution to healthcare. So in closing, I'd like to thank both of my esteemed guests and friends for joining us today to really dig into the pharmacy interoperability topic. It was a pleasure, as always, to speak with each of you, hear your insightful perspectives, and to spend a little time with you. For listeners interested in learning more about this topic, you can find links related to content and information about some of the industry initiatives in the summary of this episode. Tell your colleagues about the Dish on Health IT and let them know that they can find us on Apple Podcast, Spotify, or whatever platform you use to pick your podcasts, including Healthcare Now Radio. We also post our videos and our podcast episodes on our POCP YouTube channel. So don't forget, Health IT is a dish best served hot.
Is it a challenge to stay on top of interoperability regulations and the flurry of activity with FHIR accelerators? Email us at interopoutlook@pocp.com to learn more about our Interoperability Outlook subscription monitoring service.